Okay, special test for the hip. First one, from what I understand, is a pretty worthless test, but I'm going to show you anyway. It's the Faber test. So I'm going to place my supine. I'm supposed to check for general pathology of the hip or SI joint. So essentially what you're doing is you're going to have them kind of cross their leg and make a figure 4. And then you place the opposite foot, or foot over the opposite knee. Then I'm going to slowly lower the knee. Tell the patient to slowly lower the knee while the PT provides some pressure to the ASIS and the anterior knee. Kind of like that. And then a positive sign would be if the knee and tibia don't reach parallel to the table, which I think it's pretty close to parallel to the table, or if the knee and tibia remain above a straight leg, or if there's pain. And the next one is scouring. So once again, they're supine. The patient's leg is in full flexion and externally rotated. Then the PT applies a compression as they adduct and abduct the leg. So we're moving the femur and not necessarily the tibia. So I think it's kind of like that. So you're kind of creating an arc motion along the hip. It's kind of like that. You okay? Uh-oh. It says it's a little tender, so positive sign if there's a little pain or apprehension or any bumps or irregularities along the acetabulum. And this is supposed to test for the acetabulum or any labrum issues. So I don't know, if he keeps feeling that, he may have to go get checked out. All right, next is veneer. So this is specifically for impingement of the anterior labrum. So it's named by the position that you end in. So we're going to start in flexion, abduction, and external rotation. So I'm going to start right here. I'm going to bring him up into there. And then we want to kind of move him into flexion, internal rotation, and adduction. Okay? And then a positive sign will be if there's any pain or any clicking, popping. And then the other one, which is kind of similar to the Patrick's test, it's especially called the posterior labrum test, the Faber. So once again, we start here, and then we're going to end in, as you can probably guess, flexion, abduction, and external rotation. So they're already in full flexion, in full abduction, so you can gently rotate the tibia into external rotation while abducting the femur. It's kind of like that. And positive sign, pain, clicking, or any apprehension. Last special test, so you lie on your stomach, called the Craig's test, which is testing for any femoral anteversion that may be occurring. So what you do, get the patient prone, and then flex your knee right about there, and then you want to palpate where the greater trochanter is. So what you can do is do some repetitive internal external rotation. So I kind of feel it right about here. That's where I'm going to keep my fingers. Now what I want to do is I want to gently internally rotate him until I feel it kind of pop in my fingers. It happened right about there. So I'm going to measure this amount of internal rotation. So I'm going to keep his leg here. I'm going to use the goni. I'm keeping this kind of perpendicular to the table, and then keeping the moving arm in line with his tibia. And I see that he has about 13 degrees, so anywhere between 8 to 15 degrees is normal. If it's above 15 degrees, then we could probably suspect that he has a good amount of femoral anteversion. If it's less than 8 degrees, then it's probably going to be femoral retroversion, so they're stuck in a little more external rotation.